Welcome to your Minute with Dr. Coates. Today I'd like to talk a little bit about sleep apnea. And it's something that's really growing in awareness among the medical and dental communities. Basically, sleep apnea is what most people think of as, well, someone snoring, or when someone actually snores and stops breathing. Now, those are only two types of sleep disorders, and there are actually multiple sleep disorders that you really need someone that's trained in the field to be able to analyze and look at. But from a dental perspective, most people see their dentist more than they see their physician. So one of the things I do is every time a patient comes in is we look down the throat, we look at the tongue, look at all the things in your mouth that could be contributing factors to having a problem with obstructive sleep disorders or obstructive sleep apnea. If I see that there's an issue or your dentist sees that there's a potential issue, we can actually refer you to a sleep lab. At the sleep lab, you go through a process where you spend the night and they do a lot of testing to see, hey, do you really have a problem? If you do, there's usually two courses of treatment available. The standard and the gold standard is actually a CPAP, which is a forced oxygen that is pumped into your nose or your mouth so that it overcomes those blockages and you can breathe. A lot of people will find a decrease in their blood pressure and just in reflux issues and their energy and their concentration. It's really can be a lifesaver for a lot of people. Some patients don't handle the CPAP too well because it's like having 30 miles an hour of air being blown up your nose. So what we do in those cases is we have dental appliances. And what the dental appliances do actually is bring the jaw and the tongue forward to open up your throat. And think about your throat as really a soft tube. And so when that collapses, there's no way air can move. So by us bringing the jaw and the tongue forward, we help to open that, get the tissue out of the way, and you can breathe better. Now, some people that just snore and don't really have full sleep apnea, a simple anti-snoring device works great. There are ones that are sold over the counter, but to be honest with you, of all the patients that I've had come in with those, I have never seen one be effective and fit well and work well. And they can actually cause more problems for your jaw joints and other structures in your mouth. So if you think you've got a problem or you think your spouse has a problem, certainly bring it up to your dentist, and we can usually direct you to the right people to help hopefully save a life and make your overall health as good as it deserves to be. You guys have a great day. Thank you very much.